We've known for years that in the world of high-tech medicine, we often get too much of a good thing. In wealthy countries, perhaps 1/5 of all tests and treatments may be unnecessary, from antibiotics to cesarean sections, harming millions and wasting billions. But new evidence is revealing that too much medicine is now a truly global problem, draining precious resources from many low and middle-income countries.
Problem of overdiagnosis, overuse of healthcare services is widespread in low middle-income countries where there's a lot of very limited resource setting.
I think the problem is a cultural problem. The culture of more is better, I think, is the key problem.
I really think that we are overusing diagnostics and overusing interventions.
In an area where there are limited resources, you want to use your money wisely.
A global collaboration of 50 researchers recently reviewed over 650 studies of overuse in low and middle-income countries, involving 15 million individuals or health services across tests, drugs, and surgery.
Along with a huge team, about 50 researchers from low middle-income countries, we have did 3 systematic scoping reviews tackling the issue of too much medicine in low middle-income countries in these limited resource settings. And what we found that's widespread, taking the resources from the needed services, evidence-based effective services, to those unnecessary services, which have a huge impact at the individual level as well as system level.
For 20 years or more, the world of medicine has been concerned about the problem of too much medicine, overuse and overdiagnosis. But this scoping review is showing that this problem is not just in high-income settings. This problem is widespread in low and middle-income countries. And in places where resources are limited, clearly wasting healthcare resources is a much more serious problem because it means more people are missing out on the care that they really need.
This series of 3 scoping reviews identified many examples of too much medicine in low and middle-income countries. In China, a study estimated 3 of every 4 thyroid cancers were overdiagnosed cancers. In Lebanon, a study found a massive 70% of popular stomach medicines were potentially inappropriate, wasting up to $25 million annually. And alarming evidence of unnecessary cesarean section, including in Egypt, where 2 in every 3 births is by C-section, bringing big risks for mothers and babies.
The rate of cesarean section here in Egypt reached 72%.
The explosion in unnecessary cesarean section is happening in many countries, particularly in private for-profit settings. This is at the same time as many women are unable to access the procedure when it's absolutely needed.
There's a large international low middle-income country specific study showing that there's a huge inequities in the cesarean section where the poorest people cannot afford and cannot access essential evidence-based cesarean section, while those in the richest 5th can afford or can have access of those unnecessary cesarean section in the same neighborhood, in the same country, in the same setting. So there's a huge problem of inequity plus too much medicine.
We are now updating on the chair of the national guidelines here settings, and the first guideline that we want to do is non-medical interventions to reduce cesarean section rates. So one of the recommendations is that we have to have mandatory second opinion.
The evidence is showing that there are multiple drivers here. There's individual level drivers and there's system-wide drivers. So we need solutions tailored to both. We need more information for people, for clinicians, for citizens, but we also need structural changes that can reduce the possibilities that profit can drive overuse and overdiagnosis. We need structural solutions that can mean that appropriate guidelines are implemented. So we need individual level solutions and system-wide solutions. And I think this evidence is showing us that this is possible.
A key finding from the scoping reviews is that solutions are possible. In some places, teams have successfully achieved reductions in unnecessary cesarean sections, inappropriate medications, and overdiagnosis of malaria. But there's an urgent need for more of this work on solutions.
Most of the research we find is pretty much cross-sectional or quantitative, highlighting the problem, but very few investigate solutions.
As many health systems move towards universal health coverage, the need to use resources wisely and fairly and reduce waste are becoming key priorities.
We will calling for all the researchers that interested in the problem of too much medicine in low-middle income countries to have a collaboration.
One of the really exciting things here is that a new global alliance of researchers and others interested in the problem of too much medicine in low and middle income countries is emerging. And this alliance is currently undertaking more work and could become quite a force in the future.
If we continue doing what shouldn't be done, doing what should be done will become impossible. That's why I think it's so important to keep together working on this topic.
So there are people from South America, Latin America, there are people from Africa, Middle East, from some of the countries in Europe, some of those countries in Asia, Southeast Asia, all around the globe. There are people that's working together trying to solve this problem of too much medicine in low-middle income countries.